Unparalleled global demand. Well, it comes on the same day as a call from nearly 20 organisations representing healthcare workers who've appealed to Boris Johnson and the health ministers in all the UK nations to provide staff with better protection from coronavirus. The group, which includes the British Medical Association and the Royal College of Nursing, says measures to prevent the spread of the virus through the air are inadequate. Well, we can speak now to Mike Adams, who is England Director for the Royal College of Nursing. Good afternoon to you, Mr. Adams, and tell us about your concerns.
Good afternoon. Well, we have seen the huge impact of the virus on our healthcare workers across the UK, and sadly we have lost around 930 healthcare workers to this disease. As we learn more about the virus, we're learning more that it is more airborne. There's more research being developed around the risks associated with this. And when looking at the different settings that our members and other healthcare workers are working in, we really feel there is a case now that higher levels of protective equipment needs to be standardised as a precautionary response to keep everyone as safe as possible.
This is very interesting because at the beginning of the pandemic last year, we heard a lot about a lack of PPE, and then that went quiet as supplies seemed to increase. Are you suggesting now that, again, there is a lack of availability or that it isn't of the right quality?
No, not necessarily. I think the issue at the moment is that the current UK infection prevention control guidance, which leads and determines the selection and use of this equipment across the UK, doesn't accurately depict the airborne risks across the different healthcare settings, including, for example, where healthcare workers are staying in people's homes overnight or in public buildings. It's not recognising the adequate need for further ventilation and kind of this new knowledge that we have. So it's more about the guidance rather than the availability of the equipment. Earlier in the pandemic, it was very much, high-profile areas like intensive care units that were the most exposed to this virus were prioritised, absolutely. But we feel there is more risk now, or more known risks now, to a wider area of healthcare settings where healthcare workers are using perhaps just surgical masks in environments where we now know the virus may well be more airborne rather than droplets setting on surfaces.
Right, so in your letter to the Prime Minister and to the 4 health secretaries of the UK nations, what is it that you're asking for?
Well, mainly there are 5 asks looking for care providers to assess and improve the quality of ventilation in all settings to be able to reduce the risk of the airborne spread. We do feel that there needs to be more amendments to the guidance that I've just said to reflect an increased level of respiratory protection against the virus. We think actually guidance needs to develop in more of a collaborative approach with more multidisciplinary voices in there, also we need to see in a more accessible form the scientific evidence around airborne transmission that is available, and if there isn't enough available, we need to be undertaking more research to fill in any knowledge gaps.
OK, thank you very much. We're going to have to leave it there. That's Mike Adams from the Royal College of Nursing. Now, some news to bring you about the